Tip Today with Fran Curry.
With Slattery's Garage, Puck On. Your Peugeot car or van might benefit from a free software upgrade. For more information and to find out if this applies to your vehicle, call the lads in Slattery's Garage, Puck On 067 24111 or slatterysgarage.ie.
Garina Mahagat Pat, and welcome along to the second hour of Tip Today. Keep those calls coming into Ellie. It's a free phone number, by the way, 1800 938 007. And do keep our text and WhatsApp number in mind, because you might like to use it with the item that's coming up now. So 083 311 3311. I'm delighted to be joined in the studio by a gentleman who's been on this programme many, many times indeed over the years. Bioenergy healer Michael O'Doherty is with me. Michael, good morning to you.
Good morning, Fran. How are you?
I'm very well indeed. You're just fresh from an evening out with your friend Michael Flatley.
I don't know how fresh I am. It was a long journey back from Cork last night. Yeah. I was down at Michael's, obviously celebrating 25 years with Lord of the Dance and so on, and so he's obviously on a world tour and that. But yeah, we were down in the Opera House in Cork last night. Packed,
great night. Yeah.
Standing, people were standing.
Did he go on stage?
Yeah, funny enough, he did. At the beginning of the show, he came on to thank people and introduce a lovely little kid that won freestyle dancing, and it was just amazing. Massive buzz, huge, big crowd.
How is he? Is he all right?
As I often say, you can't kill a backing. And as he says himself, look at... He'll get through it.
Right. Well,
yeah, he's a very positive guy, you see. So
and
of course, his great faith and belief and all that. So I trust it.
Well, we wish him well. Will you pass on our good wishes to him? Indeed.
Yeah.
I know we want to talk about long COVID, but before I do that, can I drag you into the conversation that's been happening over the last couple of days on the programme? People are very frustrated with water services out there, very annoyed about it and stuff. As a healer, your thoughts on our water supply, Michael, would be what?
Oh God, that's a big question. I mean, in my area, in the health field, we're always advising people to be mindful, particularly drinking tap water, and certainly I genuinely believe our food, our air, and our water is poisoned.
Poisoned?
Literally, whether it's poisoned by chemicals, when we look at the amount of chemicals that are put into water, when we look at the amount of chemicals that are put into food, we look at the toxicity in our air, there's no doubt about it. These are huge, huge problems when it comes to our health.
Would you drink a glass of tap water?
Not if you paid me.
Just no way?
Absolutely no way. There was a time, I remember, where I grew up in Doonbeg and Clare, and, we were getting water, and God, you'd love to drink it out of the tap. Now, sure, what are you drinking? I mean, there was a guy I was looking after one time, and he was heavily involved in dealing with issues around the bacteria and in these reservoirs and all of that. And I remember him saying to me, Michael, when I look into these reservoirs, they're black. What you get out at the other end is clear, but I'm not going to tell you what makes it clear. So, it was shocking, some of the photographs I saw, and I've seen. And look, there can be a number of different reasons, and of course we can always blame the people who should be supplying it and all that. But there are lots of environmental toxins filtering their way into the water, and whether it be from industry or whatever the case may be. So it's there's a much bigger picture there. But certainly, I firmly believe, and the bottled water isn't much greater. So people are always kind of advised to get certain types of filtering and stuff like that to try and filter as much stuff.
But suffice to say, you would not drink a glass of tap water.
Absolutely not.
Wow. You're here today specifically to speak to us about long COVID, but you have a different term for it, Michael, have you?
Yeah, well, people call it long COVID, but I call it lingering COVID. And I think that, I suppose, the fact that it's lingering on for people, Fran, the time has come to really ask a lot of questions around COVID, the impact it had, whether it was the period, the COVID virus itself, or other situations that arose out of COVID. But certainly, there's no doubt about it. Certainly what we're seeing, symptoms in young people in particular, suffering from what is regarded as anxiety but could be something more. And now research is emerging to say that in actual fact, the what we call long COVID or lingering COVID is a neurological disease, and evidence is being presented and published recently in Scientific American magazine, for example, where they had clearly outlined what the findings were with regard to what they call long COVID or lingering COVID. But what's clear is that the evidence is showing that COVID as a virus is lingering in the body and can be picked up in the body many, many months after people have had COVID or vaccination, whatever the case may be.
Is the problem that the symptoms are so wide that they can be attributed to other things, Michael? Is that part of the issue?
This is the danger, you see, that that we often find with these types of situations. I had probably in the last 2 to 3 months, I had 3 different cases of young people between the ages of 15 and 22 who were actually being treated for anxiety. Okay? But on further investigation, when they would have come to me, I would have said, okay, yes, you're anxious, and yes, you have anxiety, or you're diagnosed with anxiety, and maybe sent home from hospitals with anxiety, to discover that when you look at the other symptoms they have and you advise them to go away and have further medical analysis, that it turned out in 3 different cases that I know to be POTS syndrome.
What is that?
So POTS is postural orthostatic tachycardia syndrome. So it's where it's really a cardiology issue. And, lots of the symptoms can be increased heart rate, for example, which is often mimics anxiety, increased heart rate, lower heart rate, lower blood pressure, high blood pressure, dizzy, fainting spells. And, what's happening is that they are being dismissed because they're young. A lot of younger people are being dismissed that it is anxiety when it actually isn't. And often then, of course, that's a set of treatment is put into place, and that might not necessarily help at all. And I've seen in 3 different cases where we've told them, listen, go, have further assessment, and then maybe get a further referral to a cardiologist, to an electrophysiologist, and have yourself properly medically assessed. That if you have symptoms that are lingering on, that just the idea that it's a post-viral fatigue syndrome, in my opinion, and looking at the research, that's certainly not the way to approach it.
And the people that you're dealing with, were they vaccinated?
Some would be, some wouldn't have been. The thing is, it's very easy. We could easily say, you hear a lot of people talking about vaccine damage and all that kind of stuff, and I get all that, and people can say X, Y, and Z. However, there are people who haven't been vaccinated who have had these symptoms, and there are people who just got COVID and have these symptoms. So this is
from the virus itself.
So this is kind of what we need to focus on.
Yes.
We need to however you get the virus, whether it's through some form of immunization or whatever, or whether it's just something you picked up, spike protein, whatever. Then absolutely, we need to look at that research and say, and now just over 3 years on, we're definitely seeing that the symptoms that people had, and I know people who just cannot get out of bed. They just cannot get out of bed. They have brain fog. They have all of the types of post-viral fatigue type symptoms.
And were they healthy people before they got COVID?
Normal, healthy people that were going on in life, and for whatever reason, the body just stopped, that they were pushing themselves. Now, I do also see it in a type A personality as well. People who are all the time going, pushing themselves and burnt themselves out to a certain degree and found their immune system weak. And this is an immune system issue, that the immune system isn't able to deal with this. And there's, it's amazing. Just looking at immune system abnormalities that was published on that, studies of long COVID patients with cognitive problems found signs that immune system cells from blood vessel walls had moved into the brain. These cells are not supposed to be there in that organ and can cause damaging inflammation there. Patients without cognitive difficulties had lower levels of unusual immune activity. So what I'm finding in looking at the research here is that it seems to be that because of the overload of the viral activity in the system, by whatever way means you got it, that the overload of the viral activity has stimulated an immune response in the body, primarily inflammation, and that it has broken down the blood-brain barrier and so on. It's getting to the brain, causing inflammation of the brain, and it's affecting particularly the autonomic nervous system. And what they found is that areas of the brain that control breathing and heart rate have become affected. And what they've even found in people who passed away with COVID, that they have found that it's a massive immune system response in the brain. Macrophages, which are immune cells that had attacked various areas of the brain to try and cope with the virus and affect blood vessels and so on. And there's huge research around this immune response. And, as I said to you, by whatever means that the COVID got into our system and whatever amount of times we got it into our system and whatever, the overload and the overburden of the viral activity has forced the immune system to stay switched on, and it's nearly like there's an autoimmune type problem. But the autonomic nervous system and the nervous system is definitely involved.
Are you scared then when you read the headlines in the newspapers today saying there's a new strain, it's more virulent, and it's rather prevalent at the moment with more hospitalisations and ICU cases and stuff? Does that concern you?
I'm not scared about that anymore. I mean, there's no doubt about it that people have to be mindful, and particularly, in hospitals and things like that, and the pressures that it puts on, and particularly if people have underlying conditions, obviously, that's hugely an issue. But I'm not scared about it. I think what we need to focus on is to get people to look at their immune system and how they can build their immune system, how they can recover from this period. That, as I said to you, it's not, if it is a neurological problem, if they're seeing it in a neurological form, and if it is affecting, this is what I find, that if it's affecting the autonomic nervous system, and if this overload on the system is causing the digestive system not to function correctly, affect your heart rate, affect breathing, affect concentration and focus, this is obvious because the immune system is weak and there's an overload of inflammation or immune response. So my focus a lot of the time is to help people to understand that, and to help them to understand that viral overload and the immune response, and then to set about a strategy or a program, because you just cannot sit around and this is what's happening to people. People are sitting around and thinking, well, one day I'm going to overcome this and I can keep pushing myself and keep eating the wrong food and keep doing all the wrong things, and that's not necessarily going to happen at all.
Yeah, from what you're saying to me, I mean, what I'd be fearful of is if somebody has anxiety or depression that may have been caused by picking up COVID, that they're being treated then with maybe anxiety drugs and depression drugs.
You got it. And indeed, I mean, I have had 2 cases where that has been the case. And look at, for the likes of Potts syndrome, in particular, and there can be a number of different causes for that. There is an increase. I mean, it is shown in the research here on Scientific American magazine. They have seen, they're seeing quite clearly that Potts syndrome is something that is very prevalent from this. We are seeing the increases in different types of diseases, for sure, inflammatory, so-called autoimmune type diseases. But at the end of the day, that the critical thing here is to get the right diagnosis. So I'm always mindful when people come and they say, well, I have lingering COVID. Well, say, okay, or long COVID. So what does that mean? Long COVID means that, well, you have COVID still in your system, you still have an immune system, your immune system is still responding to it, you have various types of symptoms that are neurological, could be cardiovascular, could be respiratory, could be a combination of different things. The research is saying that it's more than just anxiety, that some people will have anxiety, of course, but the important thing is to have it properly medically assessed, that if there are parents out there who children are struggling and they think it might be anxiety or whatever the case may be, if they have a number of different symptoms, well, then they should absolutely go further to have it proper medically assessed, because when you have a proper medical assessment, then, Fran, you can then look at getting a proper strategy to help them to recover.
I told a friend of mine last night that you were coming on, and he is going through a long COVID, but he's wondering about taste, because he said that his taste has never been the same. Now, it's not completely gone or anything, but he said it's never been the same since he had COVID.
Yeah, taste and smell. Some people I know that haven't got it back at all. So this wasn't your standard virus. COVID-19 wasn't your standard virus. Any strain of that wasn't your standard virus. By whatever means it arrived in our planet, and by whatever means it got into our system. And the thing about it is that, they talk about it in the research in respect of the nasal passages in particular, that sinus region, where a lot of mucus build up, and they're talking about how neurons and how the connection of that area to the brain, and it's through the nasal passages that this virus was getting to the brain and causing the inflammation and causing damage to blood vessels in the brain. So the whole idea that this is then, of course, we find with people who have a lot of the time have dizziness and vertigo. Now, again, always have the proper medical checks, but what I have found was that that the virus was getting back through the eustachian tubes into affecting the inner ear and causing that viral activity in that inner ear and affecting that communication and causing dizziness and vertigo type symptoms. Now, obviously, of course, I said I was only talking to a couple of people this week in the clinic who actually have that, but came after the virus or whatever that they may have had got. So, I mean, then you have to look at that, how it is that you're going to rectify that type of problem. And there's, like, I have some guys, they're going to Dr. Lambert in the Marshall in Dublin, I think he's and they're prescribing something like low dose naltrexone and all that kind of stuff. And I mean, obviously I can't give any advice to people, but I'm just saying that there are medics who are beginning to tune into this, and I think your ordinary GP needs to tune into it.
And that medication you referenced there, what is that?
Well, it's an antagonist, really. Sometimes people think it's an opiate and things like that, but it's really just something to try and help people to deal with a lot of the headaches that they get and the fatigue that they get and so on. So the whole idea for people is to really to begin to understand if they have symptoms and they have found it 3 months, even 8 months later, they have found the proteins, they have found COVID activity. This is the research now. They're finding COVID activity. And it's only a hypothesis from my perspective, in my opinion, is that I often hear people saying now that they are being diagnosed with COVID. But I often think that what they have is just a normal flu. And because the COVID is lingering in the body, the test is picking up that COVID activity. But in actual fact, what they may have is just a standard flu. So it is a very complicated.
Very complex, isn't it, indeed?
It's very complex.
If I present myself to you, Michael, as many people are doing, and, I give you a list of symptoms and you decide that possibly it's lingering COVID, what do you do? How do you approach them?
Yeah, depending on the symptoms, obviously. Again, first step is making sure there's proper medical assessment and that they don't have, as I said, in 4 cases, actually, there was a teacher as well, similar. It was an autonomic nervous system response. It wasn't a classic POT symptoms. Now, then, of course, they prescribe medication. Ivermectin and certain types of medications that your cardiologist or electrophysiologist will prescribe. Because when the autonomic nervous system is involved, it is going to influence heart rate and heart function and all that kind of stuff. So you have to look at that side. So it's a combination of, and I believe what's going to resolve the lingering COVID problem is a multidisciplined approach. And where one, the medical side of it. 2, then you look at the patient's lifestyle. So you look at their energy system, work with that. You look at their day-to-day life. You have to look at their food, slowly get them back into very slow exercise, depending on what it is. Sleep hygiene. Proper sleep, not just throwing down during the day. People who are sitting down in offices all day, for example, where they have a lot of blood pooling in the lower part of the body and so on, getting up suddenly, all that kind of stuff, making sure there is movement, getting people movement. So you have to get the mindset in the right zone, get them to understand the problem. There is no quick fix. There is no magic wand on this. People think, well, I'm going to go to someone and it's going to fix this problem. No, it's about understanding it, putting a strategy into place, work with the energy, work with the mindset, deal with the emotional stress and anxiety that is associated with that. Some people cannot work. That's challenging. If you have to income, whatever the case may be, to pay for your home and whatever. Then you have to look at nutrition. Nutrition plays a major role because the more we get the proper nutrition, the less inflammation we bring down. So the key here is to bring the inflammatory reaction down to stop the immune system from over responding. And I think medicine is going to look at this a little bit different as they progress. They are going to see this as a type of autoimmune type condition, and they probably are going to look at different ways. And I know drug companies looking to develop certain types of antiviral medications in this. But it's more than that. There's a little bit more. The virus got into the system, it's caused an immune response, and it's going to take a multidisciplined approach, Fran, to recover
it's
from
interesting. And if you're going through this, are you more vulnerable then to your colds and flus?
Absolutely. Absolutely, because some people are compromised, already. So they're getting COVID or whatever, and then they're more compromised, whether we like it or not. And absolutely, it's really about, and you see, this kind of goes back to your initial question with the way life has been and, the water we're taking into our body, the quality of food we're taking into our system. Our immune system are already compromised, long before COVID. COVID comes along. First of all, you have the lockdown, you have the stress of that, you have the stress of losing loved ones, the grief that arose from that in respect of those who passed away, that funerals couldn't be attended to. You have people who died alone in hospitals and in nursing homes. There's a huge element of grief associated with the period of COVID, which hasn't been dealt with. So we're kind of still focused on COVID, which I think is the wrong place to be. Yes, from a medical perspective, they can deal with that. But I think the human impact, the social impact, the impact on children, the behaviour that has changed, all of that is critical and it needs to be looked at.
And you spoke about younger people there, Michael. What about older people? Because you mentioned isolation there and you mentioned losing loved ones. And in fairness, older people, I suppose, were more than anybody else were affected in that way. What are you seeing there?
You're seeing similar symptoms in the elderly. as well. You're seeing, elderly people who used to go out but feel don't have energy, or have other sort of cardiovascular type issues that might have emerged as a result of COVID. They are fatigued. They have different types of symptoms, aches and pains, and you have people, unfortunately, at the moment who will still not stir outside the house. They're still literally afraid of their lives. They're still watching the news. They're still listening to the latest version. And the thing is that that's having a huge impact because, yes, some people are living alone. They're isolated. That's challenging. People in nursing homes, that's challenging. And whether we like it or not, there is a huge fear around this still. But what I would say to people, look at disconnect from the negativity. Just disconnect from the negativity, because if you have an elderly parent or whatever, or elderly friends or whatever the case may be, try and talk with them, encourage them, get out in nature, boost their immune system, take good supplementation, a little bit of exercise where possible, create movement, mobility, get people engaged in movement, and that's going to be huge for the elderly people.
Some queries for you, if you would, Michael. Could you ask Michael for some information and advice on leaky gut, for example? My daughter has POTS, and another thing I can't pronounce, from swine flu some years ago. Before we ever heard of COVID, she was also told of anxiety until we got to the cardiologist. She continues to have a build-up of gunk in her lungs, possibly due to leaky gut, but wondering about some advice from Michael. That's from Teresa.
Yeah, Teresa. Well, look at that's a classic example, isn't it? That something has contributed to her daughter's problem, whether it was the vaccine.
She's blaming it on swine flu, in fact, years ago. Yeah,
exactly. Yeah. So whatever caused it, but at least she's dealing with it. But critical, the leaky gut is really where the lining of the intestines are weak and food is being absorbed through. Now, look, the thing is that, people talk a lot about that and so on, but I think if you really want to build gut function, proper gut health, it's literally down to dealing with that anxiety. Now, she's obviously taking medication for POTS syndrome. She needs to be definitely dealing with her anxiety, because if you're not dealing with anxiety, it will affect your digestive system, because your autonomic nervous system, of course, affects your digestive system. You've got your esophagus and throat and all that. So therefore, the critical thing is food. I would say to Teresa, making sure, look, alcohol is really a no-no, sugary foods is really a no-no, red meat's really a no-no, cutting down inflammatory situations, building the gut through the diversity of the food, because the diversity of the food we eat on a day-to-day basis creates gut strength by creating a diversity of bacteria. When we create the proper diversity of microbes in the gut, it strengthens the gut wall and it stops that food, or that what we call leaky gut syndrome.
Right, so good food, avoid the sugars, avoid the alcohol.
Yeah, absolutely. Now, but the anxiety, and it's a while ago, so the general feeling is that with the right approach, that you can eventually manage and overcome those types of symptoms.
All right. Somebody wants Brian, in fact, he wants your opinion on, is it nattochinasis? It's an enzyme derived from natto, a fermented soybean. It clears the spike protein from your system. I found it hugely beneficial and natural, and it's being used widely for long-term COVID treatment. Is that something that you're across?
It's not. I hear lots of people talking about different things that they use for it, Fran. As I said, my honest feeling is that on all of this is that first have the correct diagnosis. That while it might be helping you in certain ways to take certain supplements, but ultimately get the correct diagnosis so you can approach it with the right strategy and the right...
right. There's not a one-size-fits-all,
No,
I guess.
Look, you can take, as I said to eliminate a lot of that overload of COVID, we often might suggest to people to take the likes of oregano and olive oregano, the likes of grapefruit seed extract and things like that. But again, that would have to be very specific. So I believe, because of the nature of the symptoms, because of the research and because of the neurological side of things, because of possible cardiovascular issues, I think for each individual you have to look at it, and it's very hard to generalize and give a general approach. Okay, so but I really think, but the real thing about it is that yes, it can be overcome. Because we're now beginning to understand it, that chronic fatigue, that inflammation of the brain, that inflammation of blood vessels, that all of that is something that bringing down the inflammation through proper rest, sleep hygiene, breath work, energy work, out in nature, good food, back to basics. And indeed, in fairness, any research that you look at, they will tell you this is the way to overcome these types of issues.
Very good. A listener playing into our discussion as well on isolation and deprivation, indeed, I suppose, during COVID. It says, my husband had a liver transplant during COVID and I just couldn't be there with him. Can you imagine the trauma?
That is traumatic. This is the point I was making to you. You know, that there's a huge element of grief in people since COVID. Well, first of all, they're grieving for the 3 years they lost in their life.
Yes.
Number one,
of course,
the isolation. Number two, the people they lost, friends they lost. You know, we see the impact on our children who had low social connection. And what did they do? They gravitated onto social media. And they've gravitated onto platforms, you know, trying to find meaning for life. You know, and I'm very concerned. That's where I'm really concerned.
And that has an impact in itself. Somebody wondering about biohealing. How would Michael describe it? What exactly is biohealing,
So
Michael?
our body is made up of energy. Okay? Very well established. Our bodies, so if we take the body, break it down to its cell, molecule, subatomic level, we're basically made up of energy. And when the energy system of our body becomes imbalanced, then our body becomes ill. So, for example, somebody could have had a traumatic experience 30 years ago that could manifest as depression or something more serious today, because the memories of all of our experiences store within the energy system of our body. For us as therapists, our focus has been always to we've developed skills over the years using our hands to feel where that energy is blocked, and we've developed a series of techniques then to release the blockages of energy. And what we find that's great for dealing with the likes of conditions like this, for anxiety, for COVID, any type of condition, that when we are stressed or come through a stressful period like we did with COVID, what happens is that we go into survival mode. What we have found working with energy that has been absolutely critical is that it's able to reset the system, that when we work with the energy system of the body and release the blockages of energy around the abdominal area, the brain, reset the whole system, that this takes the patient from the sympathetic overload back into the parasympathetic space, and this by calming the nervous system down. And then once we get that energy system right, then we support that then with the right strategy through food, mindset, emotions, all that kind of stuff. And then once we get into that zone, because everything is energy, food is energy, thought is energy. And the great thing about it is that, you know, I was just looking at very good research the other day, which really was I was so delighted to see it, that in medicine, they have now proven in medicine that empathy from the doctor or the consultant is as important, if not more effective, than the drug they're taking.
It's amazing. We had a discussion on that some weeks ago on the programme, and that is what emerged from our listeners. How important.
Yeah, it is important.
Yeah.
But what does that mean? It means that we are transmitting, and we are transmitters and receivers. You know, and I think we always need to be very mindful of the vocabulary that we use. And I'm writing about this at the moment, and I was giving the example that if somebody's inside in a doctor's surgery or a hospital, and, you know, the doctor says, or consultant says, well, this is your problem, that's it, no more we can do, blah, 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 whatever. As distinct from the person says, well, you have this situation, but you know what? We're going to do our best. We're going to throw the kitchen sink at this, and in the meantime, let's look at how your mindset is so important. Look at how your food is so important. And in the area, there's a fantastic area of research going on in medicine at the moment in the area of virtual reality. Okay, so what they're doing, we'll chat again about this, and what they're doing is they're actually using virtual reality to distract patients from the hospital environment and to distract them. Now, they're using the word distraction to distract them. And what they're finding is that it's reducing pain by up to 50% in all cases. And they're using it for women who are giving birth. They're using it for people with anxiety. So if anybody out there listening, and if they have goggles, and if they want to go use virtual reality and just sit down, put them on, go out into nature.
So it can be very powerful.
There's because you know why? We have a complete pharmacy within our body. If we create the right environment, we can produce our own antidepressants, we can produce our own opiates, and our own anti-inflammatories.
Very good indeed. All right, Michael, if people want to make contact with you and talk to you, how can they do that?
Yeah, so michaelodoherty.com, info@michaelodoherty.com is my email, or give Francis a call on 087 67 21888. We'd only be delighted to chat and help people to understand their problems a little bit more.
All right, look after yourself, Michael. Great to see you as always.
Thanks a million. Really appreciate it.
We'll take a break. We're back with more in just a moment.